Hey everyone, Dr. Vance Costello here. And in this video, I'm going to be sharing with you some of the deepest insights I can possibly give you as a dental professional. I'll be sharing with you the top 5 questions you should ask a dental implant provider before committing to surgery. This will help you determine the credibility of your doctor on a deeper level in a short amount of time. Let's begin. Question 1. What is the provider's formal education in dental implantology? Who were they trained by? What form of training did they receive? How long did it take for them to go through the training? These are all questions related to the dentist's professional schooling on implants. And they're really important. For example, I've gone to multiple CE courses where I studied underneath board-certified surgeons on how to place implants. This means I've devoted hundreds of hours taking notes, learning every possible complication that can occur. And then I had to pass rigorous exams that were proctored by other implantologists who were overseeing my apprenticeship in those programs. So as a person looking for an implant, make sure to ask for the dentist's formal education background. And if they don't have an extensive amount of formal training, I would even go so far as to ask for a guarantee on the implants. You want to make sure that the person who is placing your implants is credible. Question 2, does a dentist have a 3D CT scan? So this is something most patients don't understand. There's a significant difference between traditional x-rays and a 3D CT scan. An x-ray is a two-dimensional image showing you the layout of your bone structure. In the case of placing the implant, an x-ray would give us an idea of how close your tooth is to the implant, how thick your jawbone is, and other important territorial details that would allow us to place an implant safely. However, x-rays still leave marginal room for error. It is up to the dentist's interpretation and usage of the x-ray image to place your implant safely. A 3D CT scan dramatically limits the risk. A 3D CT scan allows us to get a complete 3D map of your bone structure so that we can plan every step of the surgery beforehand. It allows us to create a 3D printed surgical guide so that the implant is placed into the jaw at the most precise angle and depth possible. In short, a 3D CT scan reduces your risk of potential errors by a large margin. If you're looking to get implants, try to go with a dentist who has one on hand. We have one here at Neela Dental at our office, and we use it every day. I personally wouldn't want to place an implant without having one. Question 3, will the dental implant and crown be placed in the same office? So in many general dental offices, they will separate the dental implant process among 2 dentists. One dentist will be the actual surgeon who places the implant into the patient's bone. The other dentist will be the one responsible for placing the crown on the implant. There's nothing wrong with this approach as long as the doctors work closely together. This will decrease the margin for error and increase the likelihood of your final crown looking perfect. Question 4, how will the dentist take into account your specific medical conditions? The success of your implant surgery will largely depend on how your surgeon takes into account your medical condition. For example, people who have diabetes will have a much harder time healing from the implant process. So they require extra steps to ensure a successful end result. This doesn't mean that people with diabetes can't have implants, they just take a little longer to heal with the same success rate. Question 5, how accessible will your surgeon be after the procedure? This is an absolute must. The fact of the matter is that there is a small chance that something unexpected may happen after your surgery. The implant provider may have done everything perfect to a T, but for some reason your stitch comes out a week later. And now you're freaking out because you think your implant might fall out of your mouth and might get infected. What do? Can you call your surgeon and get it taken care of? You should have your surgeon's word that they will prioritize you if something wrong occurs. I also want to add a side note here. This is one of the reasons why I get concerned when I hear about people going and getting implants in another country. If something happens after they get back in the United States, they're going to have some serious logistical issues. If you get an implant in Mexico or India, come back a couple days later, and something goes wrong, you'll have to fly all the way back to get the issue fixed. Those are the top 5 most important questions you should ask before committing to surgery. I hope this gave you the insight on the variables you should consider as a potential implant patient. Until next time, this has been Dr. Vance Costello with Neela Dental.